It's now my great honor to ask fellow board member Jennifer Chan, medical oncologist of the Dana-Farber Cancer Institute and assistant professor at the Harvard Medical School, to join me in honoring this year's Lifetime Achievement Award recipient. The NANETS Lifetime Achievement Award recognizes and honors a medical professional who has made a lasting and worthwhile contribution to the field of neuroendocrine tumors and who has served NANETS in its efforts to improve the outcomes for patients with neuroendocrine tumors through multidisciplinary medical education, net-related medical research, publication of guidelines, and the exchange of knowledge and innovation. This year's recipient joins a long list of distinguished Lifetime Award honorees. They're listed here, but just to point them all out because they're all very worthy of their awards. Dr. Richard Warner, Dr. Larry Coles, Dr. Shel Oberg, Dr. Sue Odorisio, Dr. Thomas Odorisio, Dr. Robert Jensen, and Dr. Aaron Vinnick. On behalf of the NANETS Board of Directors and our entire membership, it is my great honor to recognize my friend and colleague, Dr. Kulke, for his lifetime of achievement and dedication to neuroendocrine cancer. Dr. Kulke is the Zoltan Cohn Professor of Medicine and Chief of the Section of Hematology and Medical Oncology at Boston University and Boston Medical Center. He also serves as co-director of the Boston University Boston Medical Center Cancer Center. Dr. Chan, please do us the honor of sharing more about Dr. Kulke's contributions to the NET field.
Thank you, Emily, and good evening, everyone. It is my great honor and privilege to introduce Dr. Kulke and to share with everyone more about him and his many accomplishments. Dr. Kulke is a familiar figure to many of us in NANETS, and I have had the privilege of working closely with him for many years to know firsthand what an outstanding physician and remarkable investigator he is. Through his mentorship, Dr. Kulke has shaped my career more than anyone else has, and I could not be happier to see that he's the recipient of this year's NANETS Lifetime Achievement Award. Next slide. So more about Matt. Dr. Kulke is a graduate of Princeton University, where he earned a degree in molecular biology, magna cum laude. He went to medical school at UCSF, where he was the recipient of multiple scholarships and awards. In 1992, he moved to Boston, where he started his internal medicine internship and residency at Brigham and Women's Hospital. Next slide. He stayed in Boston at Dana-Farber Cancer Institute for his medical oncology fellowship. And this is one of the earliest photos of Matt that I could find with his fellowship class. And within this great class of what has become outstanding oncologists, Matt distinguished himself as an astute and dedicated clinician. Next slide. Dr. Kulke remained at Dana-Farber for his first faculty position and became an attending physician at Dana-Farber in 1997, along with instructor of medicine at Harvard Medical School. Next slide. He had a distinguished career at Dana-Farber and Harvard Medical School, earning a Master's of Medical Science in 2007 and being promoted to full professor of medicine in 2016. While at Dana-Farber, he had the remarkable honor of receiving every award that's given by the Department of Medical Oncology that recognizes both research excellence as well as dedication and outstanding patient care. And I will add that it is very few who have achieved both of these elements of awards within the Department of Medical Oncology. Next slide. In 2018, Matt left Dana-Farber to join the faculty of the BU School of Medicine as the Zoltan Cohn Professor of Medicine, and he joined Boston Medical Center, where he is the Chief of Hematology and Oncology, the Medical Director of their Clinical Cancer Center, and the Co-Director of the BU Boston Medical Center Cancer Center. This was a sad loss for many of us at Dana-Farber, but such a huge gain for Boston Medical Center and the city of Boston and the greater Boston area, where Matt continues to focus on NET, but is actively working to improve outcomes and access to oncology care for such a large population of patients in our region. Next slide. Matt's impact in the field of NET came early in his career in 1999 when he authored a review related to carcinoid tumors that was published in the New England Journal. And this review article established Matt as a true expert in the field. Next slide. He was very quickly recognized for his skills and was able to establish at Dana-Farber the program in carcinoid and neuroendocrine tumors. This was one of the first clinical and translational programs in the country to focus solely on NET. Matt led the creation of the biobanking program at Dana-Farber for both GI malignancies and NET cancer that has formed the foundation of much of his own research, as well as the research that is ongoing at Dana-Farber to date. One of Matt's focuses has been on advancing the treatment of patients with cancer. He initiated dozens of clinical trials for patients with GI malignancies and NET. Next slide. This slide provides an overview of many of the phase 2 trials in NET that Matt has led over the years. And as you look over this list, it really reads like a history of how the treatment of neuroendocrine tumors has evolved over the years. And I think also speaks to the depths of Matt's influence, starting first with his investigation of temozolomide-based therapy in neuroendocrine tumors, and some of the early work related to angiogenesis inhibitors, starting first with endostatin in 2006, focusing later on tyrosine kinase inhibitors and other targeted agents that we have used in NET. Next slides. Matt's major contributions in the clinical trial realm have included his role as a principal investigator of clinical trials that have led to the approval of new treatments in NET. He was the principal investigator of a phase 2 trial that established the efficacy of sunitinib. This really did lay the groundwork for the subsequent phase 3 trial and approval of sunitinib for patients with pancreatic neuroendocrine tumors. Matt was the principal investigator of the phase 3 TELESTAR trial that established the efficacy of telotrestat for carcinoid syndrome diarrhea. And he had an active role in the phase 3 trials that has led to the approval of many of the agents that we use to date, including everolimus, sunitinib, and lutetium-177 dotatate. Next slide. Matt also has been the principal investigator of important randomized phase 2 trials that have evaluated the efficacy of combination therapy, including CLGB 80701, a randomized phase 2 trial that evaluated everolimus and bevacizumab in pancreatic neuroendocrine tumors. He also was the principal investigator of the CROPERATE 2 trial, which was a randomized phase 2 trial evaluating pasireotide and everolimus in pancreatic NET. Next slide. Matt's research has also extended into translational research that has evaluated biomarkers for neuroendocrine tumors. And as you can see from this long list, he has evaluated many markers that have proved to be prognostic and potentially predictive. Next slide. His research has also extended into outcomes research that has evaluated the clinical presentation, survival of patients with NET, evaluated treatment patterns and healthcare utilization in NET, and importantly, patient-reported symptom experience in patients with carcinoid syndrome. Next slide. Matt has had several other major contributions that have been long-lasting to the field. He, along with James Zhao, chaired the first NCI NET clinical trials planning meeting that established future directions for the field and has provided guidance regarding clinical trial design that we rely on to date. He, for many years, led the Neuroendocrine Tumor Working Group for Alliance CLGB that led to the development of many clinical trials that have been completed that are ongoing to date. He also has had a major contribution as a leader of guidelines for the care of patients with neuroendocrine tumors, including one of the first sets of guidelines published by NANETS related to the care of patients with neuroendocrine tumors arising in the stomach and the pancreas. For many years, he chaired the NCCN clinical practice guidelines for NET, which remains a very practical resource for clinicians. Next slide. Matt has, over the years, held several key leadership positions. As mentioned, he was the co-chair of the NCI Neuroendocrine Tumor Clinical Trials Planning Meeting, chair of the NCCN NET Guidelines Committee for many years. He was chair of the NCI Neuroendocrine Tumor Task Force in 2011 through 2014, and for 2 years was president of NANETS between 2014 and 2016. Next slide. Matt's research efforts and Matt's outstanding skills as a physician speak for themselves, but I want to add that he has been a mentor to many people, including myself. On this slide, I've listed the fortunate few who have been mentored formally by Matt, but he has been an advisor to many countless others people, many NANETS members, and is very generous with his time and his advice. Next slide. Matt is a great friend to many people, as you can see from these pictures that he shared with us. He is relaxed, kind, and always a lot of fun to be with. Next slide. But where I've seen Matt happiest and most inspired is when he's with his family, including his wife, Rachel, and his 3 wonderful children, and his father. Next slide. So I want to end with a huge congratulations and also thanks to Dr. Kulke. And Matt, thank you so much for joining us this evening. I will turn it over to you for a few words.
Well, Dr. Chan, Jen, and Dr. Bergsland, Emily, thank you so much. I am honestly a bit at a loss for words after that amazing introduction. I don't think I've ever had an introduction like that before in my life. It's really a huge honor to get this award. And in thinking about what I was going to say tonight, it's a little bit hard to know where to begin. NANETS and neuroendocrine tumors have been a really important part of my life in so many different ways. And I really feel lucky to have had the opportunity to work with all of you over these past years. I think many of the advances that Jen just talked about really would not have been possible without contributions from everyone. And NANETS has really been a framework that has allowed this type of work to occur within the field. I also really want to thank my family, my wife Rachel, who's on the call tonight, for all the support they have provided along the way. There, I would say, many experiences that I think I could highlight. There are a few that stand out that maybe are emblematic of what's happened in the field. One of the very first presentations that I did on the sunitinib data early on in my career actually occurred in Barcelona. I was asked to fly out. I was just starting out at the time. You can imagine how excited I was to give a 10-minute talk. My talk was scheduled first thing in the morning. I barely slept the night before, arrived for my talk in a large meeting hall, stepped up to the podium, and I was admittedly somewhat taken aback that in this huge hall, there were maybe a total of 5 people in total in the audience. So I guess it's good that things have changed in the neuroendocrine world since then. And in fact, it did not take long for things to change. Another parallel experience perhaps occurred at ASCO not soon thereafter. And this time, I had also been invited to present data at what was a special session on neuroendocrine tumors. I was a bit shocked and surprised at the time that ASCO had actually decided to devote an entire session to neuroendocrine tumors. I also was surprised. I walked into the room, there were actually quite a few people there. So I walk up to the front of the room. There happened to be another presenter up there who was at the time an obscure clinical investigator from MD Anderson by the name of Dr. Yao. We talked, and I think both had the sense that there was so much to do in the field that it would really be impossible for any single person to do it. It would require people to work together. And that, I would say, is probably one of the most important parts of NANETS, something that has really been so prominent throughout these many years. Interesting also, I would just point out that a very similar sense of inclusiveness, cooperation, and collegiality came from colleagues in Europe at NANETS, who in many ways preceded NANETS. I honestly can't recall at any point ever encountering some of the political issues that you hear about, the sense of possessiveness that sometimes you hear about projects or trials from anyone in the neuroendocrine tumor field. All the investigators, really, I think from the most senior to the most junior at the beginning of their careers, have really worked together as colleagues and as friends. I think committed to the greater purpose of improving treatments for our patients. The other, I would say, really great thing about this environment is that I think the sense of cooperation has helped not just patients, but also many of the investigators in the field, particularly junior investigators who are just beginning at the outset. You can hear sometimes that it's so important to have sharp elbows, if you will, to get what you want. And that has not really occurred in the field of neuroendocrine tumors. And I think it's really been to everyone's benefit. You can just look at the number of people in leadership positions at the beginning of the presentation here today, how NANETS has grown and the success of the junior faculty. and I think just be really proud and really confident in the future of the field, and that we will soon see continued important developments from everyone coming through and moving up in the field. So in summary, I just want to say I'm incredibly grateful for all the support I've received from the friends I've made through NANETS. I go through the list of every single one of you, but it would probably take up all the remaining time we have. I simply can't imagine a better group of colleagues. I want to thank you for all the experiences that have literally shaped a huge part of my life and career. I'm also incredibly grateful to my family, without whose support I never would have been able to do any of this. So as we look ahead, I think I would simply say I'm just amazed at how the field of neuroendocrine tumors and how NANETS has grown and expanded along with it. With this growth, I think, and perhaps even despite this growth, I am really confident that the spirit of cooperation, inclusiveness, and mutual support that has been such a hallmark of the field and of NANETS will continue. So thank you so much.
Matt, I want to say that I'm so sorry we're not all together in person to give this award to you. It really is so well deserved, and I want to extend my congratulations to you. I also want to thank you for everything you've contributed to the field through your commitment to medical research, clinical care, and education, and all of your contributions to this organization. I mean, you really, throughout the years, have been a major force through so much of what's happened and really made the field what it is today. I also want to thank you, Dr. Chan, for this really outstanding presentation. You really did a great job of summarizing all the work that Matt has done over the last several years.